Hello, my name is Corbin and I'm a respiratory therapy student at Parkland. This is a competency video for the nasotracheal suctioning. First I'll review the physician's orders and as well as assess the patient's chart. Following that, I will gather my equipment and perform hand hygiene. And then I will proceed to introduce myself to the patient.
What we're going to do is I'm going to detach you from the bed.
Hello, my name is Corbin. I'm a respiratory therapy student. Can I verify your name,
Oxygen
David?
up, and then I'll suction you.
Thank you.
And do it again.
So
I'm
I'm
just
here
gonna get
to
this set up real quick and we'll
just
get
do a little bit of
started.
suctioning. I'm going to be going through your nose. It's going to come down your throat. It might irritate you. It might cause a cough. And that's when I will proceed to suction. So to start off, I will assess the patient, vital signs, general appearance, breath sounds, as well as I would then pre-oxygenate the patient with 100% FiO2 to get the patient's oxygen saturation to 100%. This patient would be on a ventilator right now, so I would do that on that. Next, I will don the gloves. Alrighty, and once the gloves are on, my left hand will be my dirty hand,
Alright, we're going to take you off the vent real
and my
quick.
right one will be the
Breath,
sterile
and then
hand,
we'll get your
wrap
SpO2
around my
up
hand.
to 100%.
Then I would turn on the suction between 120 and 150 millimeters of mercury. Following that, I would lubricate the suction catheter with this lubricant. Once that is applied, I would proceed go in through the patient's nostrils until resistance is met or it causes a cough. And once a cough is caused, I would withdraw the suction catheter in 10 seconds or less, suctioning any secretions. Go through the other side as well. Directing it down the patient's trachea. And once coughed, I withdraw the suction catheter. After that, I would, if I needed to go through again, I would oxygenate the patient first, especially if the patient's oxygen saturation level was dropping. If not, then I will discard the suction catheter. I would monitor the patient to make sure the patient is not having any adverse effects from the suctioning. Make sure everything is still where it should be, ventilator settings and such. I would reassess the patient's vital signs as well as general appearance and breath sounds. And then once that is done, I would remove my trash, perform hand hygiene, and document the patient's chart that the suctioning